Hello, everyone. Welcome. Hopefully, everyone can hear me. You can maybe give a thumbs up or write in the chat if everyone can hear me.
Hello, yeah.
Yes, perfect. Hi, my name is Matthew Kusin. I work for Health Equity Matters as a senior technical advisor based in Thailand. And so we're really happy to welcome you to today's webinar as part of the SKIPA 2 learning series. So for those who don't know, SKIPA 2 is the multi-country program around the sustainability of HIV services for key populations in Asia. And so we're hosting this webinar today along with APCOM, who is part of the SKIPA 2 program, as well as a number of panelists and partners from across the region. And so really today's webinar is really to help focus on building a common understanding of Chemsex among key population communities and other stakeholders, specifically in the Asia Pacific region, to provide some good examples of good practice and innovations we have going on in here in the region. Also to identify some gaps and support needed related to Chemsex issues at the different country levels. And then also just the opportunity for those who are maybe not familiar with Chemsex to give a bit of an overview around what this is and how it impacts HIV services for key populations. And so just some housekeeping items before we get started. We do have interpretation for English and Sinhala, as one of our panelists will be speaking in Sinhalese. So please do go and click on the interpretation for English or Sinhalese, depending on your language preference. And today's webinar will be about an hour and a half, and we have a number of speakers. And so actually we'll get right into it, and we'll start off first with the presentation from Palani from Health Equity Matters in Malaysia around Chemsex 101, and then we can introduce the speakers and panelists one by one as we go through. So without further ado, I'd like to welcome Palani for our first presentation.
Thank you very much, Matt. Matthew, if you can tell me the slides, you can see them?
Yes, we can see them.
Okay, great. Thanks so much and welcome everyone. It's fantastic to see around about 120 people at this webinar from all over Asia. I'm really glad to see that. Some people I know, some people I don't, but really great to have this level of engagement. My name is Palani, as Matt said, and I work on drug policy issues and Chemsex across Asia. I wanted to start today by setting the scene and talking generally about, number one, the data that we have from the World Drug Report 2023 from UNODC. If we look at the data, we all know that year by year, whenever the drug report comes on, the number of people who use drugs and the number of people who inject drugs keeps increasing across the world. If we look at the type of drugs, there are currently about 36 million people officially who are counted as using amphetamine drugs around the world. One of the interesting factors around amphetamine use is that if you look at the gender distribution, you see that when it comes to opiates like heroin, it's 25% women, but when it comes to amphetamine type substances, the ratio is almost half and half. So that's quite an interesting fact to look at, saying that, people of all genders use amphetamine type substances. If we look at the distribution of drugs across the world, we can see that the blue dots, which are amphetamine type substances, amphetamines, methamphetamines particularly, is very much prevalent in our region, which is the Southeast, South, and East Asia region. Then we hone in a little bit on amphetamines. And what we see is that from the year of 2009, 2010, you can see the rapid rise in the quantity of amphetamines that were seized in the world, and particularly in Asia. Just want you to have a look at that interesting graph to see how much it has significantly increased. Now, if I were to impose that slide onto HIV infections in my country, Malaysia, you will see the same blue lines going up very similarly from about 2009, 2010. It's not a coincidence, I think. It's actually very much related to one another, that the rate of HIV infection amongst gay men and transgender communities is very much related to the rapid increase in amphetamine type substances. So it's not just HIV. What we see is also a rapid increase in hepatitis C, increase in the number of people having problematic drug use issues, increase in prisons, rather rapid increase in mental health issues. We also see overdose, a lot of people with cardiac issues and other overdose issues. We're seeing an increase in violence and crimes, including sexual violence. Then we see lots of issues around social issues and loss of income amongst members of the MSM-TG communities. So we have to ask ourselves why this is such a big issue in the MSM and TG community. And the first factors that we identify and we look at is the high level of self-stigma and internalized homophobia. When someone is growing up constantly being told that they are not good enough, that they are not a good person, that they are a criminal, or they are a moral deviant or an evil person, that impacts on a person's self-value and confidence. And so the pursuit of self-validation and intimacy is quite prevalent amongst MSM, particularly MSM and TG. And I would like to recommend us to read the book called The Velvet Rope, which clearly explains some of this self-stigma and shame. And along comes amphetamine-type substances, which provide an intensity of sex and perceived connection amongst participants during this chemsex, which gives a sense of connection and validation and confidence that hasn't been there in our lives. And I think that is a really important factor that cannot be overlooked. Drugs and alcohol have always played a part. They've always been a social lubricant in the lives of MSM and transgender communities to provide confidence and the ability to engage with other people in social settings. But methamphetamine takes it that much higher. There is also a lot of issues around body image and insecurities, and there's always, issues around twinks and people who are overweight and people of different color. There's a lot of segregation even within the community, and amphetamine seems to break down some of these barriers that we've put up within the community. There's also kinks and fetishes amongst MSM and TG communities, and the amphetamine use makes it easier to verbalize these needs for fetish and kink, and then engage in it in an easier way. There is also sex work, which makes it easier for people to use or necessary for transgender communities and MSM who are sex working, to use amphetamines and to work longer and to see clients that may not be all that attractive or nice. There are other factors that contribute to the increase of HIV among MSM and the use of amphetamines. Number one is really criminalization. Criminalization of drug use, criminalization of same-sex. There is double criminalization that communities of MSM and transgender communities face. This criminalization makes it very hard for MSM and transgender communities to come out, to be counted, to receive any kind of support, prevention, or treatment because of the fear of arrest, the shame, and punishment. The second major issue that we see across Asia is the low population size estimates of MSM and TG. Very often, because of the criminalization, whenever there is population size estimate efforts are being done in the country, or IBBS or is done, people who are engaging with same-sex relationship don't feel brave enough to be counted. And therefore, a lot of the time, the population size estimate is really low. And when the size estimate is really low, then the target for HIV prevention is also really low. We also see across Asia, men, because of the shame and criminalization, get married to women and have unprotected sex during chemsex with other men on the side. There is a severe lack of appropriate HIV services for MSM and TG. Because of the low numbers, they become low priority. It's in many cases, LGBTQIA issues are politicized or made more difficult by religious edicts. There is a lack of skills among traditional harm reduction NGOs and agencies to work on MSM issues or sexuality issues. And then on the other side, there is a lack of skills among MSM organizations to work on harm reduction issues. And then there is all of this, the services are also hampered by the ongoing debate amongst policymakers and program managers in departments of health and doctors about the morality of PrEP. There is still debate around whether if you give PrEP, it will increase people's sexual activity. It's the same argument that we saw in the early years of harm reduction when we wanted to give needles and syringes, and people say, wouldn't that increase drug use and drug injecting? So there is a lot of these factors that contribute also to the increase of HIV among MSM and TG. Chemsex is, people use amphetamines for various reasons, and we've heard that across the board. There are some issues. There are definitely some harmful consequences. There are definitely harmful consequences to amphetamine type substance use and chemsex, and they can be divided into these three: physical health, sexual health, and mental health. And if we were to look at them even closely, we will see that, you know, even with physical health, there is a lot of issues around HIV and hepatitis, but also a lot of weight loss, dental problems, lung issues, skin damage, anal and rectal issues, but also issues around violence and rape that happens. Sexual issues, rape and abuse, I talked about that before, but also issues around not being able to have sex without the drugs anymore, not being able to have sober sex, issues around erectile dysfunctions, issues around shame and guilt around sex. So there are many complicated sexual issues, and then there is the mental health issues. And I must say that, you know, there is increasing awareness around mental health issues that we see. People struggling with anxiety, depression, and suicidal thoughts are just some of the mental health issues that we see amongst community members engaged in chemsex. One particular mention I must make around chemsex is the focus that we need to give to transgender communities. Transgender brothers and sisters have complications that cisgender people don't, and that includes post-op complications, drug interactions between the chems and the hormones, complications around sex work and violence and abuse, I'll talk a bit more about this when we talk about Sri Lanka. The interventions that we see for chemsex around the world, if we look at Asia, the main drugs are crystal meth, along with Viagra, alcohol, cannabis, poppers, various local drugs. We see that amphetamines, because of the way they are so easy to make, they are locally produced and internationally produced. We see high rates of HIV, but we see also some really good programs coming up in Thailand and in Vietnam. In Sri Lanka, one of the issues that we saw was related to transgender, when transgender communities have had post-operation gender reassignment surgery, and then getting into chemsex before it has healed. In Malaysia, we find increase in new psychoactive substances such as liquid ecstasy, which makes it very difficult for us to keep up with our knowledge and skills around how to handle drug interactions during these times. In Europe, we see methadone, 3-MMC, and GHB and cocaine as the main drugs. Very similar issues around STIs and violence and mental health. But in Europe also, we see some really interesting programs coming up on chemsex. And particularly, one of the things that I really liked was Love, Sex, and Drugs Anonymous. So they're like drugs, Narcotics Anonymous, but specifically catered for MSM and TG communities to discuss love, sex, and drugs. In West Africa, which is the new market for all the drugs coming, from the West coming cocaine, and from the East heroin and amphetamines. And we see in some places all three existing and being used. We are also seeing, for example, in South Africa, where there are brothels and injecting rooms where you can buy both drugs and the sex partner to use at the same time. In Australia, perhaps one of a great example of how to handle crystal meth use. As we know, there was a high level of HIV prevalence in the 90s and 2000s, high level of ice use. And then with the introduction of PrEP and the extensive use and expansion of PrEP across communities, right now, Inner Sydney is about to announce virtual elimination of HIV. So it can be done, and it provides us with a good example and hope. When we look at what are the services we must provide, I'd like to often divide services and interventions into three, which is information, materials, and skills. We really need to provide people information that are accurate about the drugs and the drug interventions. They need to be provided not just on face-to-face, because a lot of the chemsex interaction happen online. So we really need online information, and we need unbiased information and medical information about PrEP and STIs. In terms of materials, we see incredible advances in party packs in Thailand, for example, and Vietnam. We see increase in the use of self-testing, but not enough, and definitely not enough PrEP, which, as we talked about in Australia, contributed to the virtual elimination of HIV there. And then just providing information and materials are not enough, because our communities are criminalized and underground. So we need to provide our communities with how to access these services, how to ensure treatment adherence during chemsex episode, how to ensure PrEP use and during chemsex and after chemsex, and how to protect oneself from violence. the key interventions that we have been seeing and supporting, SKIPA, in countries that we work with, are community-led programs. We start with community consultations to understand what is going on in the community, and then we undertake trainings and training of trainers with community workers, so community workers are skilled to go and undertake this work. Virtual and online interventions are critical. In different places, we're seeing different online interventions. Grindr and other online hookup services are not available in all countries. And in those places, there are WhatsApp groups or Facebook groups where people engage. And we need to figure out how our services can be put into these WhatsApp groups and Facebook groups. Then we need to undertake social media strategy and develop ways to engage with our communities better online. HIV testing and treatment, specialist clinics like pulse clinics that have started are a really good model, and increasing self-testing. And last but not least, once again, I harp on the use of pre-exposure and post-exposure prophylaxis. PrEP is really critical. The important element is also not just with the communities, but also with our governments and our policymakers. I think it's really critical that we advocate for decriminalization of drugs for use and personal possession, and decriminalization of same-sex relationship. This will improve treatment-seeking behavior, will improve availability of services, and will enable early interventions so that we can actually provide services for those who are experimenting or using it recreationally and having trouble before they become dependent users. We need to, communities of MSM and TG organization need to engage with organizations that are working on harm reduction, such as Support Don't Punish, and we need to increase training for medical practitioners. Matthew, I'm thinking that my time is up, right?
Yes, if you can wrap up, thank you.
No worries. So I just wanted to put up some global and regional resources. There are a range of resources that are online. Community Manual, Mainline has very good resources. Instagram, there are different different toolkits that are coming up on Instagram. So if you keep an eye on that, there is a group that pre-meeting that is happening in Munich conference. There is the other resources that we see. That this is the Chemsex manual that's online. You can Google it and you can get it online. I want to thank Nikki and UPCOM for this initiative and for bringing everyone together. Thank you all of the speakers for coming together and being brave and confident and bringing your experience to the region. And on behalf of SKIPA, I thank you for being here.
Thank you so much, Melanie, for that wonderful presentation and really setting the scene for us. So feel free, if you have any questions, to write so in the chat, and we'll keep moving with the next two presentations. So next we'll have two good practice presentations. So one from Vietnam, followed by one from Thailand. So we can start off with Vietnam, and this is really about from the community-led Chemsex response there. So we have Tung Don from Lighthouse Vietnam, as well as Y+ Global, who will be sharing with us their experience. Thank you.
Thank you very much, Matthew. I hope that you can see my slides.
Yes, can you put on full screen mode? And we can hear you
Awesome.
well. Yes, it's good
Great.
now.
Thank you very much. I would like to thank Health Equity Matters and APCOM for having me in this whole webinars on Chemsex, and thank Palani to share a very comprehensive overviews of the pictures of the Chemsex in the region. All right, so my name is Tung and I'm Executive Director of Lighthouse Social Enterprise in Vietnam, and also the advisor for program management at the Global Network of Young People Living with HIV. I'm also a part of the Asia Chemsex platform as well. So today I'm very proud, but also humble to share our little works on the Chemsex for community in Vietnam. We call peer peer-led intervention and also integrated services for Chemsex community in Vietnam. So this is some photos from our team and also our activities with the LGBTIQ community in Vietnam, with many events and also some separate meetings with the particular MSM and trans and also Chemsex community in my country. I always start with this, how can I say, like diagrams or analysis of the multiple barriers. I know that Palani have shared many graphs and diagrams showing about the different issues and different program in the regions. But for Lighthouse, we use this as the foundation for us to design the appropriate program for the community, and also to show that community are facing with multiple challenges that hinder them to achieve the health outcomes. To be honest, that we don't have much resources to do all things. So we just start step by step by address some personal issues and also doing some advocacy works. I will not go into details of these barriers, but as you can see, community are facing multiple challenges like lack of knowledge, self-stigmatizations, service provider stigma, and also a criminalization with the people who use drugs in Vietnam. So this is another very interesting slice. When we do our study in 2019, we realized that there are a very different cultures from the Chemsex community with the general MSM or LGBTIQ community. So they use different languages. They have their own like channel to interact with the other people from the community. They use very different icons to really like recognize the member of the Chemsex community on the guided dating apps and also the social media channels. So we use all of this as the tactics for our outreach and also communication with the community. Let's take a look into the services and support package that Lighthouse provide to the community, and we divide them to 3 different levels and pillars. In terms of the physical health, we deliver HIV and STI services, also hepatitis, asthenia, and also dental issues. In terms of mental health, Palani also mentioned about a different type of mental health disorders and issues that people are facing: anxiety, depression, psychosis, and also self-stigmatization. In terms of the social support, we realize it's really important to have the social connection and social interactions for the Chemsex community, and also providing the policy and legal support to the community. The other, a little bit separate pillars is recovery behavior management. So we focus on cut down and cessation, focus on support for reducing dose and frequency using a different personal therapy for the community, like CBT or motivational interviews. We also do cut down and also some therapy to help people to cut down, reduce the frequencies of using Chemsex or maybe using drugs, and also cessation of the drug and prevent reuse. This is some primary interventions at Lighthouse. Like I said, we do step by step. So we start with awareness raising because one of the prime findings from our surveys is community like a lot of information and knowledge on harm reduction and also drugs, and also available services and support for them. The second strategy is to promote on-demand comprehensive health services, trying to offer the wide range of services and support to the community at our clinic, but also like in the other referral system. And the third pillars is to provide the chem care and also psychosocial support to the community to make sure that they have some connection and interaction in the social aspect and also psychosocial aspects. Yeah, so it's a little bit more details in terms of awareness raising. We have the peer-to-peer meetings, a very safe spaces for community to share their concerns, exchange with the others, and talk with each others about their own issues and their own concerns. It's not necessarily always on HIV or maybe harm reduction, but it can share like their own love stories, something very personal related to the Chemsex and also the community. We also have some specialized materials designed by the community themselves, what they want to include into the materials, and we disseminate it in our clinic, but also in the community events. We also have the specialized communication channel. We have the HiFun fan page with more than 10,000 followers at the moment. And a very new product from Lighthouse team, we have the community health station websites, where we provide a wide range and comprehensive services and information to the community. On the second strategies, on-demand comprehensive health services, we have the personal support and outreach team, and also on-site support with the more details later in the following slides. And lastly, we also offer Chemsex care plan, also Chem recovery groups. That is a very new initiative from Lighthouse, and also we're trying to generate idea from the community for the family support. This is more photos and more like informations about the details of our strategies, optimize online outreach. So guiding apps, we also have the peer educators who work on the other social medias where community have a lot of community member in there, trying to provide like some informations, and also trying to bring their friends to really listen to their concern, and also stories. This is another demand generations social media channels from Lighthouse. We have the HiFun fan page with more than 10,000 followers. But we also have the Lighthouse Community Clinic, and also with the Use fan page for specific community who living with HIV. This is our strategy to diversifying appropriate content with community. As you can see on the screen, it's not just only harm reduction or drugs, but also like information about sex, and have the safer behaviors while doing chemsex. Also addressing common issues like meth mouth, or some people facing with the sleeping disorder or headaches. So we're trying to provide as much as we can the information that is relevant to the community. This is some products, like some handbooks from a very different kind of information, not just only HIV, but also like STI, also PrEP and mental health and self-care. So overdose is also another concern from the community, and how to do first aid, especially among the Chemsex groups. So we also do have some kind of like materials to disseminate to the community how they can do like first aid for people who overdose with GHB, for example, but how they can prevent overdose as well as along with some information about relevant law and policy in Vietnam, that they can ensure safety and security for themselves. This is another photos on outreach and commodity distributions. We not only use like in-person outreach, but also like social media outreach platform to make sure that community we can reach the hardest to reach community on multiple channels. This is the Chem Care boxes, an example from Lighthouse Vietnam. But I mean, like I list down a lot of commodities here, but we do not have resources to provide all of them. But this is the ideas from the community through the consultation. So if your countries and your programs, you have resources to provide all of them, that could be really helpful for the community. Not just only HIV self-test kit or condom and lubricants, but people also want to have the STI self-test kit, for example, Hep C, or maybe drinking straw, or smoking pipe, or lip balms, or like harm reduction and health handbooks. So yeah, this is a long list, so I will not go all of them, but you can see on the screen at the moment. This is Lighthouse Clinics. So we adopt the peer-led service delivery. It means that all of our healthcare staff belong to the community in order to provide the friendly and quality services to the community. This is a very brief about the services that we deliver via our clinic. Some we can directly provide to the community, but we also refer them to some professional services. So our strategy is trying to diversify service to meet the comprehensive needs of the community, and also use the person-centered approach to make sure that community they feel belong to and they feel safe to share their issues with our community and with our peer educators and healthcare providers. This is the procedure.
Sorry to interrupt. If you can please wrap up.
Okay,
Thank you.
sure. Yeah, so this is procedure of service delivery at Lighthouse Clinic. So we have the drug use screening tool, and also with mental health screening tool, and then based on the result, we provide the tailored services to the community. As you can see here, in combination with some personal therapies like motivational counseling, cognitive behavior therapies, Chemsex support groups, etc. We are working on the new models. It's called Chemsex group therapy. It's called EPARC. So this adopt from the 4.8 from smart models, and also the CBT personal therapies. So we have like 4 different groups with the MSM age 25 and older to adopt these EPAC models. And we have in total 8 sections and depends on the groups. So we will have the very different topics for different sections. With the main points is trying to increase their inner motivations, and also their capacity and ability to manage their own behaviors, and also strengthen their belief in, like ability to have the safer practice while doing Chemsex. Yeah, I think that is my last slides. And thank you very much again for your listening. And I will back it to the moderator. Thank you.
Thank you so much for that wonderful presentation. So I think, yeah, a lot of the times we hear about, chemsex and the problem, but I think this did a fantastic job on like what kind of services. And I see there's some questions in the chat on what these services might look like before this presentation. So hopefully this answered some of those questions for you, Harry, and others. And yes, feel free to continue to write your questions in the chat. Next up, we have a speaker from Thailand who will be sharing, who works for the government and sharing how the government is supporting community-led responses. So I'd like to welcome Kun Sapicha Techno to present. Thank you so much.
Hello, everyone. Okay, first of all, okay, wait for the slide. Okay. 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 First of all, when I introduce myself, my name is Chapisha Tesho. I'm a psychologist. I work at the government office. I am a government official, work at the Bangkok Health Center, Department of Health, Bangkok Metropolitan Administration, Thailand. Today I'm gonna talk as a behalf of the government official who work with the network and who work with the NGO that help us too much, because by the way, of the government, we are very hard and very difficult to get the everything from the people who use drug, because government is very real formal. So that this is the way of the Bangkok work with the network and deal with the people who use drug. Okay, next. Okay, next 4 slides. Next. Okay. Back, please. Back. Okay. If you see this, you will see that's why I'm here to stay and work with the poor people who use drug, because you see the evidence base is very dangerous for the people who use drug, especially with the MSM that use a lot of the drug more than straight or other people, and all the thing that they use drug is bring them to be have to use drug a lot, like a stress, like suicidal idea, or family problem. Okay, next. Next. Okay, next. Actually, we classify the drug with the effect with the brain, but for me, I classify with the how they use and what the goal that they use, because as a therapist, it is help too much if we group people who use drug with the why they use the drugs in the way that they use. Hello. Hello.
Can hear you now.
Okay. Okay. I log in with the two. You hear me, right?
Yes.
Yes, we can hear you. Yes.
Hello. Hello, you hear
Yes,
me,
we can
right?
hear you, Pidin. Yes.
Yes, I can hear you.
And we can see you on the screen. Yeah. Pidin, can you hear us?
Recording in progress.
Hello.
Thank you.
Okay, you hear me?
Yes.
Okay, sorry.
Yes.
Sorry. I had a problem with the network. Okay, continue, right?
Yes, please. Thank
Okay.
you.
Okay, this is the way I treat for the people that I group the people who use drug with the group by the way that they use. Okay, next. Next slide, please. Okay. This is not a joke picture, but this is really true that this is the way the people who get happiness and drug can be give them for the most happiness. And if the next slide, please. Next slide, please. Yes, and if drug accompanied with sex will be more and more happiness you give for the people who use. Okay, next. Next, please. Okay, I found that people have used chemsex with the ice or methamphetamine, GSB, MDMA or ecstasy. Next, ketamine and popper is used a lot, and maybe 90% is used popper. Next, please. Yes, and the next one is Viagra. Please back. Yes, Viagra is not too much people talk about Viagra because they don't think it is the narcotic, but I want to say that this have affect a lot with the people who use chemsex because eyes is make the have the problem about the election of the penis, so that if have a problem with the election, they will use the Viagra. So that for eyes, it can be make the cardiovascular have the problem because they have it can make the vasoconstrictions. Yes, and Viagra can help because Viagra is the vasodilate, so that it is in the not the same way, so they have the problem a lot with the vascular. Yes, next please. And I found that have some people use heroin because they have the problem about the ejaculation, and heroin help them too much. Yes, next. Let's talk about harm reduction in Thailand. And talk about harm reduction in MSM in Bangkok. We have CBTX. I'm not sure that you never get heard before. CBTX is the community-based therapy and treatment and harm reduction. This is the one of the way to help people who use drug in Thailand and Bangkok too. Community-based is we give the power for the community to look after each other and look after themselves to when they have problem, when they use drug or have no problem, and they can stay together and help each other to stay in the community with happiness and no problem. Next. Next, please. Yes, this is the staff in my clinic. We have 3 doctors, we have 1 psychologist, we have 1 nurse and 3 social worker. How to harm reduction? We harm reduction in the 3 factor: biological factor, psychological factor, and social. Next. Okay, next. Go next. Go next. Okay. Okay. 1 more. Okay, and 1 more. Okay. Oh, next. Back, please. Okay. We have biological factor, psychological factor, social, and we have spatial ways, the legal care and PR. Because if the only hospital or government hospital is we are not good at the PR, but NGO or another network is can PR too much and can PR very, very good. So that by all we can help them like for PrEP and STI checking, and we have chest PA or chest X-ray for screening for the lung and about TB or tuberculosis. We have psycho test or psychological examination. We have social worker to work with the people who use drug. We have the NGO that work about the right and human rights and LGBT right. So that we have drop-in center, we have safe zone, and we have the good create activity to stay together. And for the legal care, we work with the police. And I will talk later that what we work with the police. Yes, Nick, please.
Please, Kun Sopicha,
Yes.
we only have 2 minutes left, if that's okay for you. Just
Okay,
a reminder.
okay.
Thank you, Ka.
Okay. And this is the way that we work with the people who come into our CBTX. Next, please. This is harm reduction card. This is the masterpiece of the Thailand, because this is have the reward from the Thailand medical service. Harm reduction card is we give for the people who come with us and being the partner or being the member of the program of harm reduction. I want to say that it's impossible that people who use drug will come to the hospital if they don't need to stop use drug or if they don't have the problem with using drugs. But harm reduction is the way that put people who use drug come to hospital by their willing. Because if you say you have to come to see doctor, you have to look after your health, you have to look after your body. They don't need they don't need to look after, because some of people, because a lot of people use drug with that no problem with the body or relation or everything, but people who use drug is scared with the police and scared with the legal. So that this card it helps too much, because if you if someone use drug and get this card and file with the police, and they will show the police that I am under look after of the doctor, or I am the member of the treatment program in the hospital. I don't need to say they are patient, but just a member of the program, because someone is very normal. They have no problem anything. So that this card is can be can be talk with the police that they are under program or under under treatment or under look after of the hospital. We talk about this card maybe 4 or 5 years. First year is the police is not agree with us and don't know, but now people around Bangkok is know this card, and they know that if they see this card, they will know that they are teaching in the hospital or the member of the program of the harm reduction of Bangkok Metropolitan Administration. So that, and this card is not give them and go away. They have to come back to follow up every month, so that at least we will see the member of the program one time in a month, so that they have when they come back to follow up, we can follow their self in a month before and a month apart, and what they're doing, what's going on, and follow their self, and they can mirror their self, and they can look to themselves that what they did, and they can be look after themselves in the next month or next time. Actually, we have the special program we call quota, and we call the start program. This is the program for stop need to use drug. Yes, and this is very long time if I have to say. So that this harm reduction card is very, very important for us to work with the people who use drug. And next, please.
Reminder to wrap up now, PT.
Okay, next. This is our partner. This is all the NGO in Bangkok. Next. Yes, this is the program. This is the activity of us. Next, please. Next. Next. This is the Center of Community-Based Therapy and Harm Reduction in LGBT, first place in Asia Pacific. So that we are so proud that we have this center. And this center is located in the gay sauna. You know, gay sauna is the way this is the way gay to go to have fun and play together and have a sexual activity. This is impossible that psychologists or pop-up service will come there to help them about drug using and also sexual problem too. So that this is the first place in Asia Pacific that have the community-based therapy center in the LGBT, especially in the sauna. This is our masterpiece, and we are so proud of this. Yes, next please. And we have Chemsex First Edge in the Thai version. Next. Yes, and we have the second place in the Fasirung. This is the NGO of LGBT. This is the second place of the CBTX. Next. Yeah, and we have Pride Clinic. This is the clinic for LGBT, especially for LGBT in the Public Health Center of the Bangkok Metropolitan Administration. And we have Chemsex Clinic, the first clinic in Thailand. Next.
Okay. Remember to wrap up.
Okay, this is the last slide. This is my my slogan, I mean, our umbrella, they are not made to stop the rain, but it was made to keep us to going in the rain continuously. Thank you.
Thank you. And we'll always remember that umbrella is very important.
Yes.
To never let the rain stop us. So yeah, thanks นะขอบคุณครับ
Thank you so much.
Thank
Thank
you
you,
คุณโสภิ
Nikki.
ชา
And thank you for AppCom to invite me to be speaker. I'm sorry
thank-
for my English.
Oh, no worries. You're good, nah. I think it's really wonderful to see the implementation in Thailand. And particularly the harm reduction part, like, maybe we can hope that, it can be adopted in several countries across Asia. So we're going to go to a panel. I know like we're lagging a little bit behind, not a little bit, we're lagging behind, but anyway, we're gonna have this panel. Let me introduce the speakers for the panels. Desi Andruching, or usually I call Drew, from Hash in the Philippines. And we're going to have Ads Aziz, or from Malaysia AIDS Council. And we're also going to have Indonil from Heart to Heart, the community-based organization in Sri Lanka. And last but not least, Miss Lisa from TDEX Collective, which is Transgender Drug Experience Exchange from India. So we have 4 panelists. And in this panel, we really would like to understand the Chemsex specific issues and ground realities at country level. And we really want to also understand and identify gaps and much needed support for these issues. And maybe we can find solutions together. Last but not least, we also like to identify opportunities and challenges for Chemsex responses. While at the same time discussing maybe a potential advocacy efforts with the goal of how to effectively influencing policy changes and decision-making process at the higher level. So thanks so much. Yes, we have 4 wonderful people whom I know, new, old and new. So I have this actually, one question. What are the primary Chemsex related issues that are constantly happening with communities at country level? May I repeat that? So what are the primary Chemsex related issues that are constantly happening with the communities at country level? So I'm not going to put you on the spot because you're on the spotlight already. So anyone would like to answer that, please?
Yeah, sure. Nikki, may
Unmute,
I?
yeah.
First of all, thank you. Hi, I'm Lisa Yashvinder, and thank you, AppCom and SKPA for organizing this wonderful and a very, very, important webinar. I think this is one of the pressing issue, I have been working with the community, and I know that, in 2010, it used to be just alcohol and few substances, but with the 2014 and 15 onwards, we have seen that people are going on to stimulant use. And it started with high fun. It started with a very small thing for poppers to kind of, now going to MDMA and cocaine. If I talk about, and within this whole umbrella, as I'm representing the transgender community, and which my collective is all about, transgenders drug experience exchange. So what we have found that first, there is this lack of understanding about the drug. At times people are really, it's different for them to kind of understand what drug they are taking in, what it would have the impact on their life, how it can impact their mental health, and of course the physical health and their relationships altogether. Second, also, there is a confusion between the substances also, in terms of whether it's a sexualized, drug substance, or it's a Chemsex. Within Chemsex, what kind of things comes in. Then it has kind of impact within the community. There is a lot of stigma. The moment you say that I'm a transgender, I'm into sex work, and I often go for drugs, it is a further layer of stigma which comes on the community. And within community, let's be honest, within communities, we are at the bottom of the pyramid. The further, stigmatization, marginalization happen even within the community. A lot of, I think, labeling comes with us, because data somewhere, show the evidences that people who are into hyphen, who are into, chemsex, are having, higher positivity trends, of HIV or SIV or any sort of infection. So that label also comes in, which brings down the whole mental health of a person, so it's impacting your mental health, makes you more vulnerable, because the group which I'm particularly working with is transgender women who are into sex work. So, it is a necessity for them, as I said by Palani, and I totally agree to that, if we don't take it, if we don't go on MDMA or stimulant use, it's really difficult for a trans person to stand whole night and do sex work and earn for his or her livelihood. So I think these are the major challenges which our communities are facing. And of course, I think there is also lack of, services per se, because the traditional HIV prevention programs, whether it's NGO or CBO, doesn't have understanding about stimulant use particularly. So I think that is a major challenge, because none of our communities are getting any sort of support in the existing infrastructure. So we are kind of, totally isolated is, I think, the major challenge. With this, I'm taking pause and looking forward to hear from others so that we can talk, more things in the later part. Over to you, Nikki.
Thank you. Anybody else would like to respond to that? We really hitting like the layers of stigma.
අදහසක් පළ කරන්නම්.
Oh, yeah,
බොහොම
please.
ස්තුතියි අවස්ථාව
Yes.
දුන්නට. විශේෂයෙන්ම මම මුලින්ම කියන්න ඕනේ අපේ රටේ කෙම්සෙක්ස් කියන මාතෘකාව මම හිරවටේද අපේ රටේ කෙම්සෙක්ස් කියන මාතෘකාව තරමක් අලුත් මාතෘකාවක්. I think විශේෂයෙන්ම අපේ ප්‍රජාවන්ට තියෙන මූලික ගැටලුවක් තමයි නිවැරදි තොරතුරු නැහැ සමාජගත වෙලා අපේ ප්‍රජාව තුළ කෙම්සෙක්ස් සම්බන්ධයෙන්. විශේෂයෙන්ම මේ කෙම්සෙක්ස් වලින් වෙන නෙගටිව් ෆීඩ්බැක් එක මොකද්ද? එහෙම නැත්නම් කෙම්සෙක්ස් සඳහා යොමු වෙන කෙනෙක් HIV STI වලින් ආරක්ෂා වෙලා කොහොමද මේ දේවල් කරන්නේ? සහ කෙම්සෙක් කියන දෙයට ඇබ්බැහි වීමක් වගේ දෙයක් වුණොත් එහෙම එතකොට ඒ දේවල් වලින් මිදෙන්නේ කොහොමද කියලා සහ මොන වගේ ආයතනයකට යොමු වෙන්න ඕනේ කාටද කියන්න ඕනේ මොන වගේ සේවාවන්ද ගන්න තියෙන්නේ. ඉතින් මේ පිළිබඳව දැනුවත්භාවයක් නැහැ. හරිය නිවැරදි තොරතුරු නැහැ. එතකොට ප්‍රජාවේ පුද්ගලයන්ට මේ නිවැරදි තොරතුරු නැති වුණාගෙන් පස්සේ ප්‍රජාවේ පුද්ගලයන් අතරමයි මේ දේවල් හොමාරෝ කරගන්නේ. එතකොට ප්‍රජාවේ වැරදි තොරතුරු එකතු වුණාගෙන් පස්සේ වැරදි මතයක් තමයි සමාජගත වෙන්නේ. ඉතින් මේක ලොකු ගැටලුවක්. මොකද මේ ප්‍රජාවේ පුද්ගලයන් කතා කරන්නේ තමන්ගේ අත්දැකීම් තමයි ෂෙයා කරගන්නේ. එතකොට ඒගොල්ලෝ අත්දැකීම් මත තමයි ඊට පස්සේ ඒගොල්ලෝ වැඩ කරන්නේ. ඉතින් මේක ලොකු ගැටලුවක්. සහ අපේ ප්‍රජාවේ අයට මේ තොරතුරු දැනගැනීමේ හැකියාවක් සහ තොරතුරු නැති වුණාගෙන් පස්සේ ඒගොල්ලෝ දන්නේ මේ ඩ්‍රග්ස් කියන්නේ මොනවාද, මේ ඩ්‍රග් වලින් වෙන හානිය කොච්චරද, ශරීරයට මේකෙන් මොන වගේ හානියක් වෙනවද, මේ දේවල් දන්නේ නැහැ. අනිත් කාරණේ තමයි අපේ ප්‍රජාවට නිරන්තරයෙන්ම අලුතෙන් ප්‍රජාවේ පුද්ගලයන් සම්බන්ධ වෙනවා. විශේෂයෙන්ම ග්‍රයින්ඩ් ඇප් එක හරහාම කට්ටිය සම්බන්ධ වෙනවා. එතකොට මේගොල්ලෝ කෙම්සෙක්ස් කරන්න යොමු වෙනවා. හැබැයි මේගොල්ලෝ දන්නේ නැහැ කෙම්සෙක්ස් කියන්නේ මොකක්ද කියන එකවත් දන්නේ නැහැ. එතකොට ඒගොල්ලෝ සමහර විට ගංජා වගේ ඩ්‍රග්ස් එක පාවිච්චි කරලා ඉවර වෙලා එතනින් එහාට ඊට පස්සේ ආයිස් එහෙම නැත්නම් හෙරොයින් වගේ ඩ්‍රග්ස් එකකට යනවා. එතකොට මේගොල්ලෝ නෑ මේකෙන් වෙන හානිය කොච්චරද කියන එක දන්නේ නැහැ. ඉතින් ඇත්තටම ලොකු ප්‍රශ්නයක් මේ නිවැරදි තොරතුරු අපේ සමාජයේ නැති එක.
Thank you. Anybody else would like to quickly weigh on that? If not, I'm going to move to other questions. Yes, please.
Yes, so
Drew. Drew or I think Drew got his train. Okay, and then after that, go to you, Ed. Okay, yeah.
Yeah.
Quick one, yeah.
As we all know, we are in the middle of the war on drugs here in the Philippines, and this is a major barrier for both the community, the Chemsex community, and the service providers trying to provide services for the Chemsex community. We also lack capacity in when it comes to the community and the service providers giving services and trying to reach the community, the Chemsex community. We also need to sensitize the community of providers so we can increase reach and access to much needed services, especially PrEP and hopefully eventually the access of our Chemsex community to injectable PrEP as well. So basically, that's it.
Thanks for that, Drew. Ats, please.
All right, thank you, Nikki. So I believe Malaysia having the same problem, and also same issues. But basically in Malaysia, based on research by University Malaya, we have around 10% of MSM engaged with Chemsex in Klang Valley. So basically the Klang Valley is actually the capital city of Malaysia. But we believe that the Chemsex users are actually more than that, more than 10% for the MSM. Because based on our personal experience, if we change our profile on Grindr to chill or CF or something like that, most of the time around 50 people going to tap on you or start texting you, expressing their interest to meet or to engage with Chemsex session with you. Okay, and of course, this is more concentrated in a city area and less compared to other places. I also would like to what Palani said that these Chemsex users, so all the Chemsex users, are not really willing to come forward for harm reduction programs. So we are in Malaysia currently designing a program to cater this issue, including to engage with the CF organizer. Because in Malaysia, the location of the location or the geographical place is actually also play a major role in the CF user because of it easy to get substance in Malaysia, and also the price is affordable. For 1 gram for meth, you can get around 150 ringgit, which equivalent to around 30 USD. All right. And those who are afford, they usually give kind of a sponsorship to MSM young population. This is actually like a motivation for them to have sex with those who have the staff or the methamphetamine. And also in Malaysia, the connectivity using online connectivity for the Chemsex user is really wide. So they can order the methamphetamine online and it can be delivered to your doorstep at a minimal delivery charges. And also they know that those who are using the Chemsex and also those who are those where to get the drugs basically in Malaysia. So I don't want to talk about the health issues, mental health issue, and sexual health because Palani already explained that one. So over to you, Nick.
Thank you. Thank you. You know, I'm an Indonesian, so you know we're neighbors, and practically we I think we have the same issue, and I think everyone in this panel have, you know, well, we will live in challenging settings, although maybe not the same issue, but you know, different context. But yes, we live in the challenging setting where, you know, response of Chemsex has become, you know, it's a sensitive issue, but you know, it's very much needed, and the action of Chemsex activities is actually happening, you know, and it's nothing new, and it's already happening since, you know, a long time ago, and there will never be like the perfect time to do effective response, and you know, we should just, you know, start talking more about this and start having effective response for this emerging issues, not emerging issues, like these constant issues for the communities who need it the most. I think, you know, since, you know, we have around 15 minutes only, I still have 2 questions. Like for any one of you, please feel free to jump in. Like, is there any specific Chemsex related response currently taking place in your country, or maybe are in the pipeline? Maybe you can explain that in a short one. Thank you. Anyone?
I can quickly start in. I think
okay, Lisa, yes.
Yeah, so I think in India, particularly, if I say, About Chemsex, I'm sorry, but so far, no intervention, which is working on, and that is a major challenge. I'm just taking pause by saying so because it is a very big issue. Only we are the first collective, which is a collective of transgender women who are into sex work, who are showing the intersectionality and stimulant use, are just doing it a very, very small level, which is like negligible if you compare the length and breadth of the country. But I think with this, we are still have to reach that state. I'm so happy to see that other Asian countries are doing great work. Yeah.
Hello.
Thanks, Lisa. Yes.
Can I share? I am from Nepal.
Oh, sorry. Sorry. I'm very sorry. Yeah, we are having the panel. I'm really sorry. Maybe we have more time later to hear from Nepal. Sorry, yeah. We'll if we have time. Sorry. Thank you. Ads in the
All
deal
right.
or
Sure.
Drew, yeah, please.
All right. Sure. Thank you, Lisa, and also Nikki. In Malaysia, we do have a very small scale of the Chemsex-related response. And basically, we are exploring to expand that. So, for example, for currently in Malaysia, we have peer-led intervention by Leviate and also Negative Anonymous, specifically for gay and transgender group. And basically in under the Ministry of Health Malaysia, we have around 77 or to 78 one-stop center for addiction clinics, all better known as Oscar Clinic. But this clinic has not been fully utilized yet to cater the Chemsex users. So we are planning to, because we already have the resources, so we are planning to make it more accessible to the Chemsex user and to make it more Chemsex friendly. And also, we also created a link tree as one-stop center for HIV and also STI prevention. We also include Chemsex tools, the link tree. I'm going to share the link to you in the chat, so maybe you can tap on the link tree. And also right now we have information on CF, what to do in case of the emergency, and also the facilities that the CF user can go if they need helps. And also we also offer free PrEP in Malaysia, and also free HIV testing, and also supports. That is what currently what we have right now in Malaysia. Thank you, Nikki.
I'd like to highlight the importance of having a virtual intervention on this issue. Like I think it would be one of the most effective ways to really reach the hard to reach population of our communities. Drew or Indonil, please.
Yeah. So the Global Fund has been working for several years now around Region 7 or the Cebu region, specific to the PWOD and PWOD community response in terms of HIV services, service provision in that particular province. Now, currently also UNODC is actively working around policy changes around drug use and harm reduction. Also upcoming is a program with positive action through APN Plus to establish baselines around PWOD or drug services access, drug user services access in the National Capital Region, as well as establishing baseline for the same community. So hopefully with these programs, we will be able to respond and widen the access to services, HIV services in the capital region as well. Thank you.
ඔව් ඇත්තටම අපේ රටේ තියෙන කෙම්සෙක් සම්බන්ධ මැදිහත්වීම් ගැන කිව්වොත් එහෙම එකක් තමයි දැන් හැම රටකම තියෙන ප්‍රශ්නයක් තමයි කෙම්සෙක්ස් කරන අපේ ප්‍රජාවේ පුද්ගලයන් අට සේවාවල් ලබා දෙන්න මැදිහත් වෙන්න අමාරුයි කියන එක. ඉතින් අපි ඒකට විකල්පයක් විදියට කෙම්සෙක්ස් කරන පුද්ගලයන් සඳහාම පාටි පැක් එකක් හදලා තියෙනවා. පාටි පැක් එකෙන් අපි කරන්නේ කෙම්සෙක්ස් සඳහා අවශ්‍ය කොන්ඩම් සහ ලුබ්‍රිකන්ට් ඒ හරහා යොමු කරන එක. එතකොට පුද්ගලයාගේ අවශ්‍යතාවය මත පදනම් වෙලා තමයි අපි මේ සේවාව දෙන්නේ. එතකොට අපෙන් ඉල්ලන ඕනම වෙලාවක අපි ඒගොල්ලන්ට පික්මී ෆ්ලෑෂ් හරි කුරියර් මාර්ගෙන් හරි ලබා දෙනවා. ඒ තුලින් අපි උත්සාහ කරනවා ඇත්තටම මේ පැක් එකේ කොන්ඩම් ලුබ්‍රිකන්ට් විතරක් නෙවෙයි ප්‍රෙප් ගැන පෙප්සි ගැන දැනුවත් කිරීමේ ලීෆ්ලට් එකක් අපි දාලා තියෙනවා. සහ අපේ නැෂනල් ප්‍රෝග්‍රෑම් එකේ නෝෆෂුවර් වෙබ්සයිට් එක ගැන ඒගොල්ලොන්ට ඇවිල්ලා ටෙස්ටිං කරගන්නවා නම් මේ දේවල් ගැන අපි දැනුවත් කිරීමක් කරලා තියෙනවා. සහ අපේ කන්ටැක්ට් නම්බර්ස් දාලා තියෙනවා. ඉතින් මේ හරහා ඇත්තටම අපි බලාපොරොත්තු වෙනවා අපේ සේවාලාභීන්ට සේවාවන් දෙන ගමන්ම අපිට ඔවුන් එක්ක හොඳ සුබදතාවයක් හදාගන්න සහ අපි අපේ නැෂනල් HIV ප්‍රිවෙන්ෂන් ප්‍රෝග්‍රෑම් එක හරහා ෆිසිකල් සහ වර්චුවල් කියන අවුට්‍රීච් ක්‍රමවේද දෙක හරහා අපි අපේ සේවාවන් කෙම්සෙක්ස් කරන අපේ ප්‍රජාවේ පුද්ගලයන්ට ලබා දෙන්න කටයුතු කරනවා.
Thank you, and fingers crossed for all the ongoing initiative, and those are in the pipeline. Fingers crossed that it will add a value to the Chemsex response, in your settings. So I have one last question, and actually we only have 5 minutes for this panel. So let's hear from you all very quick. Like, what is your vision? In one sentence, what is your vision for a Chemsex response in your country going forward? And one urgent need or support that you need to help that vision. I hope it's quite clear. I tried to shorten the question. So in one sentence, what is your vision for Chemsex going forward in your country, and what is one top need, the one thing that the most important need or support to help realizing that vision. This support could come from stakeholders, including governments. Yeah, so I hope it makes sense, the question. Anyone?
Yeah.
Yes, Miss Lisa.
Thank you, Nikki. A lot of things I wanted to say, but yeah, it's like the positive time. I would say maybe, my vision for way forward is kind of, one of the very inclusive, supportive, and, ensuring the health equity in one line, which means to that, there should be a comprehensive care which will be, addressing the physical, mental, social health of all the individuals engaging in Chemsex, irrespective of their gender and all other, addressing the vulnerabilities which are around them. And also in the existing program, we need to bring that element of, Chemsex. We need to bring that element, how to address the issues of Chemsex. A very small to small thing, if there is an overdose, many of the existing HIV interventions don't know how to deal with it. And I also see a last thing, which I always say, friend raising. We depend a lot on our friends from, IDUF network, for example, or maybe drug user networks and, NAPUD, and because they are the people who are technical experts. We are not, we need to kind of come together hand to hand and work in a very, very effective manner so that we can address these issues all together and can provide a very comprehensive services delivery and harm reduction delivery to our communities. Yeah, over to you. Thank you.
Thank you. Indudel? Yeah.
ඊළඟට කරන්න. මගේ බලාපොරොත්තුව තමයි කෙම්සෙක් සම්බන්ධ නිවැරදි තොරතුරු අපේ රට තුළ සමාජගත කිරීම හා එහා සම්බන්ධ සේවාවන් නිවැරදිව සහ ගුණාත්මක සේවාවන් ලබාගත හැකි ක්‍රමවේදයක් අපේ රට නිර්මාණය කිරීම දායක වීම තමයි මගේ බලාපොරොත්තුව. ඉතින් මම මේකට ඇත්තටම අපේ ආණ්ඩුව පැත්තෙන් සහ අනෙක් සංවිධාන වලින් බලාපොරොත්තු වෙන විශේෂයෙන්ම ලංකාවේ ආණ්ඩුව එහෙම නැත්නම් රජයේ ආයතන රාජ්‍ය නොවන සංවිධාන විශේෂයෙන්ම LGBTIQ ප්‍රජාව වෙනුවෙන් වැඩ කරන ආයතන කෙම්සෙක්ස් ගැන කතා කරනවා අඩුයි. කෙම්සෙක්ස් ගැන දැනුවත් කිරීමේ වැඩසටහන් කරනවා අඩුයි. ඉතින් ඒක ලොකු ගැටලුවක් කියලා මම උත්සාහ කරනවා. අපි සියලු දෙනා එකතු වෙලා මේ වෙලාවේ දැනුවත් කිරීමේ වැඩසටහන් ක්‍රියාත්මක කළ යුතුයි කියලා විශ්වාස කරනවා. අනිත් එක තමයි අපි අපේ ආණ්ඩුවේ National HIV Prevention Program එකෙන් දිගින් දිගටම අපිත් එක්ක සම්බන්ධ වෙලා මේ සම්බන්ධයෙන් වැඩ කරන්න ඕනේ. එහෙම වුණොත් තමයි අපිට පුළුවන් කෙම්සෙක් සම්බන්ධයෙන් මේ තියෙන ගැටලුව निराකරණය කරන්න. අනිත් කාරණය තමයි අපි කෙම්සෙක් සම්බන්ධයෙන් කතා කරනවා කෙම්සෙක් කරන පුද්ගලයන් ගැන කතා කරනවා. නමුත් කෙම්සෙක් කරන පුද්ගලයෝ වෙනුවෙන් පෙනී ඉන්න කවුරුත් නැහැ. ඔවුන්ගේ ගැටලුව කතා කරන්න කවුරුත් නැහැ. ඉතින් මම හිතනවා අපේ කමියුනිටි එක ඇතුලේ කෙම්සෙක් කරනවා කිව්වොත් ඩ්‍රග් යූස් කරනවා කිව්වොත් ටිකක් කොන් කරනවා වගේ ගතියක් අපිට පේනවා. ඒ හින්දා ඔවුන් වෙනුවෙන් කතා කරන්න ඕනේ. දැන් කවුරු හරි කිව්වොත් මම මේකට ඇබ්බැහි වෙලා ඉන්නේ මට මේකෙන් මිදෙන්න අවස්ථාවක් දෙන්නකොත් එහෙම ක්‍රමවේදයක් නැහැ. ලංකාවේ තියෙන්නේ පුනරුත්ථාපන කඳවුරකට දාලා පුනරුත්ථාපන කරනවා වගේ සිස්ටම් එකක්. නමුත් කමියුනිටි ෆ්‍රෙන්ඩ්ලි කමියුනිටි එකට සම්බන්ධ වෙච්ච එහෙම ආයතන නැහැ. ඉතින් එහෙම දෙයක් සම්බන්ධ වෙලා එහෙම ආයතනයක අවශ්‍යතාවය මට මේ වෙලාවේ පෙන්වලා දෙන්න පුළුවන්. ඊට අමතරව තමයි තොරතුරු දැනගැනීමේදී local language එකෙන් අතරම තියෙන්න ඕනේ තොරතුරු දැනගන්න. ඉතින් අපේ රටේ නැතිම දේ ඒක. ඉතින් මේ වගේ දේකුත් සම්බන්ධ වෙලා තියෙනවා හොඳයි කියලා හිතනවා. සහ අපි ප්‍රජා උපදේශකයන් විදියට සහ මේ National HIV Prevention Program වල වැඩ කරන virtual සහ physical outreach workersලා කෙලින්ම ආණ්ඩුවත් එක්ක එකතු වෙලා වැඩ කරන්න මේ ප්‍රෝග්‍රෑම් වල. ඊට අමතරව ප්‍රජාවේ පුද්ගලයන් සමග කෙලින් වැඩ කරන්නේ. එතකොට ඒ අතරමැද පුද්ගලයන් විදිහට තමයි අපි සම්බන්ධ වෙලා ඉන්නේ. අපි ආණ්ඩුවටත් තොරතුරු ලබා දෙනවා සහ අපෙන් ප්‍රජාවේ පුද්ගලයන්ටත් තොරතුරු ලබා දෙනවා. එතකොට මේ දෙපැත්තටම අපි නිවැරදි තොරතුරු දෙනවා නම් අපි දැනුමින් පරිපූර්ණ වෙලා ඉන්න ඕනේ. ඉතින් මගේ මතය නම් අපි මේ තොරතුරු ලබා දෙන්න අපි සියලු දෙනා මේ කෙම්සෙක් සම්බන්ධව හරි නිවැරදි තොරතුරු වලින් දැනුවත් වෙලා ඉන්න ඕනේ. ඉතින් මේ දේවල් කරගන්න සියලු දෙනාගේ සහයෝගය මම අවස්ථාවේ බලාපොරොත්තු වෙනවා.
Thank you. Thank you. That's
Okay, thank you, Nikki. So we aim to build more resilient and also supportive environment for individuals affected by chemsex and also chemsex users. Because in Malaysia, chemsex users, especially MSM and also TT, the transgender community can be punished under the penal code, which may lead to multiple criminalization. I believe Padani's team currently working hard to put effort on the decriminalization for the drug. Also, we need an enabling environment by implementing policies that can reduce stigma and also discrimination against individual engaging in chemsex. This also involve what our colleague here said, that the education and also awareness campaign that can foster the understanding and also the knowledge in our community. By enabling also the access to the safe space and also support network where this the CF users and also individual affected by the CF can see help without the fear of judgment and also the imprisonment. That is the most important thing, I think, to be done in Malaysia. Thank you, Nikki.
Thank you. Last but not least, Drew, please.
Right. So the vision is to have a multi-sectoral approach in addressing the needs of the chemsex community. And conversely, the chemsex community reaching back to the providers. This has to be a mutual thing so we can better respond to the HIV services need of the community. We have to step up across different sectors, different communities, different KPs affected by HIV. Nonetheless, we have to have a more urgent and more response to the needs of the community, and this has to happen soonest because as the longer we wait, the more delayed and the far off we are from achieving the zero goals towards 2030. Thanks.
Thank you, and good luck with that assessment of chemsex in the Philippines. I believe it's it might not be the first, but one of the first that's going to take place in the Philippines. Thank you so much for all the speakers and panelists. It's really good to have you all sharing insights, what's really happening at the country level, and hopefully we can do something collectively together to find maybe the right way or the right approaches for effective advocacy for people in the higher level, those people who those people in the higher office that can make a policy change, and while at the same time we as the community create a meaningful intervention for community who are really close to our heart, right? So thanks so much. Matthew, are you back? So thank you so much, panelists.
Yes, thank you so much, Nikki, and all the panelists. So next up, we're almost finished today. Don't worry. Thank you everyone for engaging. I know this is a long webinar, but very insightful. So we'll have Francis from NAPUT, who is the regional coordinator here in Asia, to share some community feedback. Francis?
Am I audible, Matthew?
Yes, we can hear you perfectly.
Yeah, thank you so much, everyone. It's a pleasure to be here, and lovely to hear from all the speakers. To start with, I would like to reflect on Palani's slide where he highlighted that approximately 36 million people use amphetamine type stimulants and new psychoactive substances across the world. And why do people use? It gives a sense of connection and validation amongst men who have sex with men, trans and gender diverse communities from all walks of life to enhance their sexual experiences, which leads to physical, sexual, and mental health issues, raising a concern for all of us. However, it is important to be aware of the risks involved, like the negative effects of polydrug use and unsafe sexual practices. It can lead to HIV, viral hepatitis B and C infection, and of course, mental health illnesses that could be lethal and a possible overdose as well. A common combination, which I come to hear from many of our friends, is Viagra taken with alkyl nitrites, which is commonly known as poppers. It may have a severe impact on one's health. There are ever increasing numbers of people who use stimulant drugs, including new psychoactive substances, which is clubbed with a lack of understanding, social stigma, limited information, and lack of services as well. There is a lack of peer support, internal stigma, power dynamics in sexual relationships, and the combination of drugs and sex work, as this was also highlighted by the speakers. It is important to understand harm reduction. Harm reduction for amphetamine type stimulants that focuses on minimizing health, social, and legal risks associated with their use. Strategies include providing accurate information, safe usage guidelines, and medical and mental health support access. There is a requirement for safe consumption spaces and drug checking services to reduce the immediate risks. Legal reforms such as decriminalization and flexible laws helps to mitigate legal consequences. Peer support and public awareness programs may help reduce stigma and promote safer behaviors. These approaches aim to enhance the safety and well-being of users while respecting their personal choices. I commend the vital work led by the Health Equity Matters SKPA2 team and the strenuous efforts put in by APCOM in addressing sexualized drug use involving amphetamine type stimulants. I applaud the work carried out by Vietnam, especially the EPAC model by Lighthouse, Also, the harm reduction card that is applied at the Bangkok Health Center on harm reduction and community-based therapy, and also as highlighted, talked by Lisa from India, Indunil from Sri Lanka, Andrew, my friend from Philippines, and Aziz from Malaysia. I encourage the continued focus on harm reduction strategies to enhance the collective impact. These includes providing accurate information. We need to all join hands in advocating for decriminalization and drug checking services, which is the utmost, priority and importance for all of us. Also promote peer education and support groups. Formation can also foster a supportive community. Everyone's efforts are essential in mitigating the risks and promoting healthier outcomes for those involved in sexualized drug use. Remember, it is of people who use stimulant drugs, for people who use stimulant drugs, and by people who use stimulant drugs. Thank you all for what you're doing. I salute your dedication. Thank you. Over to you, Mike.
Great. Thank you so
Matt.
much, Francis, for those wonderful community perspective on today's panelists, as well as all of the presentation. So yes, this comes to the end of our session today. So just on behalf of Health Equity Matters, as well as the entire SCIPA team, including APCOM, who helped co-coordinate this panel. Just want to thank all the panelists, speakers, as well as participants for your participation today. So Health Equity Matters, formerly AFAO, is a key population organization and the peak national organization representing Australia's community response for HIV. So as we heard today, chemsex and sexualized drug use is really an emerging issue that's making a major impact on the work that we are doing, especially for gay and bisexual men, as well as trans people, including those engaging in sex work. And really a lot of the conversations before today and a lot of the research is really based in high income countries, as well as Western countries. And so we really hope this conversation and this sharing of best practice from within our region here in Asia has been really insightful for all of the audience members today. And also just want to share for those who are attending the upcoming AIDS conference in Munich, we'll actually for SCIPA be having a poster presentation, I believe it's on Tuesday, focused on the Sri Lanka work. So that you've heard a little bit today, but actually we'll go into a bit more detail during that poster session. There's also a Chemsex pre-conference, I believe on the Saturday, being hosted by Reshape and the Chemsex Forum. They, I think, also have a hybrid option. So keep your, eyes open for that. And then I know there are also a couple of presentations and posters from ACON and some other organizations around some of the chemsex work that's happening. So that'll be really exciting. And yeah, just thank you again to everyone. Hope you enjoyed the session, and we'll share the recordings as well as the PowerPoint presentation within a couple of days. So yeah, big thank you to everyone and hope you have a good rest of the day. Bye-bye. ขอบคุณครับ
Thank you, everyone. Thank you so much. See you on our next webinar. Terima kasih. ขอบคุณครับ